with 4 deaths and 33 recoveries. I've been asked if we are flattening the curve. As with most of the country, it is too early to tell. We are in a situation which involves day by day, and absolute certainty requires more data than we have. The biggest mistake we can make is believing that any one number means our problems are solved. We all need to follow the social isolation directive provided regardless of the number of new positive cases. This is not someone else's problem. We all have a role in fighting COVID 19 to survive, to recover, and to rebuild our economy. We need to stay home. Even if the number of new cases remains stable, even if the rate of recoveries increase, we must remain vigilant. We have never experienced a situation like this before, and a number of mistakes will be made. Even a perfect response won't end this pandemic. But what we can do things to make this is a little bit easier to bear. COVID 19 is not just a public health battle, it is an economic one too. While we are all affected, some are hurting more than others. As I've said in previous press conferences, my administration has been working with federal partners to give you the relief you need. But for too many, federal aid may take longer than they have, even if it is only weeks away. Thanks to the work of Department of Revenue and Taxation Director Daphne Shimizu and GITA Deputy Director Dr. Ricky Hernandez, I can report that Guam has received IRS approval for the total estimated cost of $134.8 million dollars of federal economic impact payments to be paid to the government of Guam. Because our government was among the first territories to submit our draft implementation plan, we believe that checks associated with this program can be cut within about 2 weeks of IRS approval. I know that for the most vulnerable in our society, even that may be too long. For this reason, and under my cash management authority as governor, I have directed the processing and release of over $11 million in local funds to be paid by this time next week. Tax filers with adjusted gross income of 10,000 or less in tax year 2018 will receive checks in the amount outlined by the federal economic impact payments. Checks again, which will be cut as early as next week. While this local advance will help more than 10,000 individuals and children, we are mirroring federal requirements so that this amount can be reimbursed with federal funds. To do otherwise could jeopardize our response to COVID 19, damage basic government services, and cause unintended consequences. My intent is to help our most vulnerable people as quickly as possible, knowing that federal funds will flow. Let me be absolutely clear. This isn't new money we have found that can be appropriated for other uses. I am able to make this available now because of prudent cash management with the expectation that such funds will be flowing back to Guam. There is no additional cash for new programs beyond this point. I know that some of you might ask, why didn't we do this sooner? The answer is simple. No one should have to deal with empty promises or faulty financial plans. I wanted to ensure that we could identify cash for this advance, that it would be federally reimbursable, and that it wouldn't jeopardize our response to COVID 19 or other basic government services. And most of all, I did not want to make a promise I couldn't keep. I also want to thank Speaker Tina Munya Barnes, Vice Speaker Nelson, and Senators Lee, San Augustine, Shelton, Castro, Pito, Terlai, Marsh, and Torres, and others who have asked me to find a way to help those who need it the most. We made this happen together, and I'm thankful for your advocacy. In each of these press conferences, I have asked Guam for unity and solidarity, not just as cheap platitudes, but as the singular way we can survive the great challenge before us. We will get through this. We just need to do this together. I'd like to bring Linda DeNorsi now to give you some COVID update status.
Thank you, Governor. Thank you, Governor. Yesterday, we had 39 tests done, and of the 39, 33 were negative. 1 was positive, 3 is a follow-up, and 2 are rerun. The testing from March 12, 2020 to April 8, 2020 is a total of 678 cases of tests. Of that number, 553 are negative and 125 are positive. Now, of the 125, we're breaking it further down as follows. 122 of those COVID positives are further broken down such that 111 are local and 11 are from the U.S. Naval Hospital. The tests were performed through the Department of the Defense Reference Lab in San Diego. In addition, there was 1 confirmed case from Diagnostic Laboratory Services, which the department is contracted with for more commercial testing. And there are 2 clinically diagnosed local cases. And thus, there is a total of 125 COVID cases. The demographic breakdown of these COVID positive patients are as follows. 65 reside in the northern region of the island. 41 are from the central. 17 are from the southern region of the island. 2 are homeless. Thus, 125. For the age breakdown, they are as follows. 0 to 9 years old, we have 1. 10 to 19 years old, 7. 20 to 29 years old, 12. 30 to 39 years of age, 12. 40 to 49 years, 23. 50 to 59 years of age, 23. 60 to 69 years, 33. 70 to 79 years of age, 9. 80 to 89, 4. 90 and above, 1. In regards to the gender, majority are female at 66 and the males are 59. In regards to the medical status, currently 74 of our COVID positive patients are stable, 14 are hospitalized, and that is broken down as follows. 5 are at GMH inpatient care, 2 are at the ICU, 7 are at SNU. As the governor mentioned earlier, 33 have recovered, 2 more as of today or yesterday. Deaths 4, and the grand total again 125. In regards to the location of these cases, 44 remain in home isolation, 30 are in the government of Guam isolation facility, and as I mentioned earlier, 7 are at SNU, at GMH, 5 are at the GMH inpatient unit, 2 are at the GMH ICU, 33 have recovered, 4 have died. In regards to the travel history, we have 17 that have a travel history and 108 with no travel history. So of the 17 individuals, 3 travel to multiple countries, and 60% of those traveling, majority have traveled to the Philippines. As I mentioned earlier, 108 have no travel history, and so the breakdown of those with no travel history are as follows. 31 are household contacts, 11 are community contacts, 19 are healthcare contacts, and of that, we have 6 that are healthcare contacts as a patient, and 13 are healthcare contacts as a healthcare worker, and 47 reported no contact at all. Currently, our quarantine facilities, we have 152 patients currently under quarantine at our Government of Guam site. In regards to travelers completing the 14-day quarantine, today 2 have completed their quarantine. Thus, a grand total of 231 have completed their 14-day quarantine. And 30 continue to remain in our isolation facility within the government. As I mentioned earlier, and the governor has two, 33 have fully recovered. And the demographic breakdown of those fully recovered are as follows: 0 to 9 years old, none; 10 to 19, none; 20 to 29 years of age, 4; 30 to 39, 6; 40 to 49 years of age, 7; 50 to 59 years of age, 6; 60 to 69 years, 7; 70 to 79 years of age, 1; 80 to 89 years of age, 1; and 90 and above, 1. And again, those that have fully recovered, of the 33, 17 are female, 16 are male. In the terms of the demographic region of their livelihood where they reside, 8 live in the northern region of the island, 15 at the central region, 10 at southern. And travel related to those that have traveled, for those that have fully recovered, 8 and 25 have no recent history of any travel. I also promised the media that I will disclose information regarding our clusters, or what we call the groups settings that we have. From March 14 to March 20th, we are going to report the following clusters. We had a Hafa a day bingo where we had 2 to 3 positive COVID cases. And to date, there are no other cases affiliated with that establishment of where they had gathered. And their timeline for the 14 days is complete. So we're not worried about them at this point in time. The Sinyahanya Senior Center was another area where we had 3 positive COVID cases. Another area was a golf trip in the Philippines, and this individual also plays bingo. So there was a total of 4 positive cases. So that person that went golfing also had a golfing partner, and also he also had 2 other household contacts. Thus, there are 4 infections in that particular group. There was also a couple that went to the Philippines, and it resulted in that couple affecting 2 other people, one being their son and the other their son's friend. There were also cases that are travel related. We have 1 positive case related to, in the early end, traveling from the Philippines. And we also had off-island social gathering in the Philippines where 4 became infected as a result. And that was 2 sisters, a cousin, and a brother that's clinically diagnosed. There was also a fundraising activity that was related to 3 positive cases, all in the same household. So within that time period, there were 22 positive cases with these 7 types of clusters. In addition to that, we have also 7 other clusters that we've identified. As I mentioned earlier, was the Iglesia Ni Cristo Church, where we identified 11 positive cases. And as you know, that church also comes, and they have a church facility at Jigo, Harmon, and also the Opera Agate. There was also a family gathering, a birthday party at one of the hotels, and that resulted in 5 patients being COVID positive due to that gathering. There were 2 settings from the healthcare workers particularly, and that resulted in 17 positive cases. And as you know already, we had travelers that came from the Philippines through the United Airlines, that we had 3 cases from the quarantine facility, and 1 United Airlines flight crew, and also 2 United Airlines flights from Honolulu to Guam. And what we're asking everyone, if you are in any of the final 7 groups of settings, we ask you that you please call the department right away so that we can immediately determine if you are a close contact with an individual who has been diagnosed to be COVID positive. You can contact our numbers, which are as follows: 480-7859, 480-6760, 480-6763, and 480-7883. Thank you.
Thank you, Linda. Open for questions now.
I-94, Chris Barnett.
Half a day, Governor. Governor?
Yes.
Okay, half a day.
Have a day.
Governor, tomorrow, Good Friday, there aren't going to be any grab and go meals available. The Guam Department of Education has provided 260,000 meals for the island's hungry. And these people line up, the line stretches miles long at 12 different locations around the island. They wait for hours just to get little bag lunches because they have nothing to eat. In the meantime, you have continually told the displaced workers and those who have been financially impacted by COVID to apply for food stamps. During yesterday's press conference, Linda gave out 5 phone numbers. I just tried calling those 5 phone numbers, Governor. Only one of them works. 4 of those numbers are not in service, and I just it's very frustrating because you keep telling everyone to apply for food stamps, and I don't know if you guys don't recognize the need out there of the people of Guam, but there's just not enough phone lines. Department of Labor has 3 phone lines, and we're talking about 30,000 displaced workers trying to call 3 phone lines, and no one's getting through. And we're getting all the calls. The JIC is getting calls. So I guess my question to you would be, can you do more and maybe mobilize some of these non-essential government employees who are staying at home earning a full paycheck to maybe man some more phones? And are we doing anything to, meet the very, very great demand that people have out here for these services?
First of all, Chris, I just wanted to make sure that the people of Guam are assured that our administration is doing everything we can to provide the needs of our people. We're very concerned about the needs of our people. We're very concerned about the livelihood of our people. We're very concerned that our families and our children are fed. We are very concerned also that we provide as much transparency as we can in all the things that we are doing. And I am especially appreciative of all the people who are making the sacrifices to meet the needs of these people of our people as best we can. I'm not aware about the phone lines. Linda's right here. She assures me that they are working. I don't know if it's when you called that people were online and couldn't answer your phone call right away. There's a lot of other reasons that maybe why they're not answering the phone. But I know that I have called those numbers myself and that they are working. Also, the 311 number is also very accessible, and I've tried it myself too. I have called the 311 and I asked to be directed to the medical triage, and the medical triage nurse was very, very professional. I mean, I didn't say this is the governor of Guam. I just said, I'm just checking to see, how things are. And they were very professional. I know that we are working hard to get as many phone lines as we can. We also are aware that once our pandemic unemployment program starts, that there is going to be a lot of applications as there are right now. And so we are working to get the online applications going. We're working to get an employer portal going. We're working to route as many as these inquiries as possible as we can through internet, online networking, and so forth. And the reason, of course, is for expediency, and the other reason is so that we can continue having social distancing and continue to decrease social contact. Once we institute our economic recovery payment plan, we are aware that there are going to be some face-to-face also kinds of interactions, and we're trying to minimize that exposure as best we can. So I just want to say, Chris, that no one system, no one government is perfect. And we continue to get as many ideas and suggestions and recommendations that we can, and we try to implement that. And of course, the whole agenda and the whole goal is to provide the needs of our people. As you know, this is a very unprecedented situation. We are evolving as it goes along. We are planning our processes as we go along. This is not unique to Guam. This is everywhere throughout the whole United States and also throughout the whole world. So, phone lines, we're going to get as many phone lines as we can. I wanted to thank the telecommunications people. They have donated over 50 phones and phone lines, and they've increased their broadband to help us out with this. And so, again, if you didn't get answers from the rings or the calls that you did, I will have Linda investigate it to make sure that those phone lines are open and are working. But as far as my assessment and my checking on it, they were all working.
Okay, Governor, maybe I need to use your phone. My second question, Governor, is many of the island's working poor file their taxes as soon as they can in January. And so I know that you just paid out tax refunds up to November 2nd. And we get a lot of calls about people, the tax refunds, you don't need to go write anything to the federal government. You don't need the senators to give you any authority. So why won't you pay out tax refunds from January back to November 2nd and put that money into the people's hands right now today?
Chris, I just want to say it's not that I won't pay them out. I have been paying them out. I think that's not a very accurate characterization of what we've been doing. We have been paying it out. And my last information with Ed Burns is that we are current in our tax refunds. We are paying up to November, December, and we are current in all of the tax refunds that we have put out. So it's a wrong characterization of what our administration is doing.
Governor, I'm just saying that according to your press release, the latest tax refunds that you released were up to November 2nd. So
That's
I know
correct.
the court order.
And my information with the Department of Administrator, Ed Burns, who writes the check, and also through my Department of Revenue and Tax Directors, that we are current with all the filings of the tax refunds for fiscal year 2018.
Thank you, Chris. Pacific Youth Center, Kevin Kerrigan.
Yes. Good afternoon, Governor. Can you hear me?
Yes, Kevin.
I'd like to go back to that 111 million that you said will be available as soon as next week. Can you give us some more details about that? For example, where is the money coming from? What is the criteria for eligibility? And how much would each individual get? How do they apply?
So it's not 111 million, it's 11 million.
Yes.
And I may have said 111, and probably that's just wishful thinking because
No, that was my mistake.
that happened. Okay, so it was 11 million. I just wanted to make sure I said what I said correctly. I don't want to, confuse the people. So the program is such that we would be able to provide checks to 10,000 individuals to include children. So this program, Kevin, is the program that the federal government has initiated, established, and put into law to help the individuals in assisting them in their financial needs. It's a one-time payment. It's a one-time rebate. And what it is that if you have, it's based on your tax filings, and we are using 2018 filings. That's our record. And so what it is that if you The general program is if you have an income of $75,000 and below, you get as an individual $1,200. If you file as a couple and your income is 150,000 and below, then your benefit is $2,400. Every child under the age of 17 gets $500 from your household. As your income increases, you still are eligible for some rebate, but the amount decreases by some calculation that is being done. And I think it's completely phased out for somebody with an individual income of 150,000, I believe. Not too sure about that, but there is a cutoff in terms of income. Our program, what I am doing is, and by the way, we're eligible for this benefit, and IRS has estimated and has agreed upon on an amount that would be sent to Guam, and that's $134.8 million. And so what I have done, because this program probably won't be implemented till 3-4 weeks from now, because we still have to have our implementation plan approved. And I have to thank our Department of Revenue and Tax Director, Daphne, because she was really on top of it. And we were the first ones to actually put in our implementation plan. Right now, it's being reviewed by the IRS attorneys, and then will be given to the Treasury to be approved. It's a lot of bureaucracy and a lot of requirements we have to do. But with the aggressive, proactive work of Daphne, she was right there in the very beginning. So we're one of the territories that have submitted our implementation plan. Once that's approved, 2 weeks from that implementation approval, we would be expecting to be getting the money so we can start paying out those checks. So in order for us to bridge that gap, what I did was I am advancing the payments to those individuals who I think or we have seen in the lowest income bracket. And so it's those that are 10,000 and below in income will be receiving the same amount. $1,200 for individual. We follow the same program because it's a federal program that I am just advancing in its payment. It's sort of like a federal grant in aid program. And so because it's a federal program, I am allowed to advance that, and I will get reimbursement for that money. The money that we are using to pay that is from the general fund. We are actually floating from the general fund $11 million. And I am comfortable doing that because I know we will have reimbursable federal grants. Some people will ask, how come I haven't done that sooner? Well, I wanted to make sure that the amounts that we are going to be getting is a solid number and will be sent to Guam. And we have assurances from the IRS that is going to be happening. I think that's it, right? You asked me one more other thing.
Yeah, thank you, Governor. Yes, it was only 11 million. That was my mistake.
Right.
But just in terms of eligibility, you said it's those who would qualify make $10,000 a year or less.
No. Okay.
And how do they qualify? Where do they go? Revenue tax is closed.
Everyone that has filed a tax return is eligible. And I can have Daphne come talk some more about it. But if you have filed your tax returns for 2018 and 2019, although we're using 2018's filed return, everyone that has filed that is eligible for it. The amount is based on your income level. So in order for me to advance and with the monies that I can afford, I decided that those people who filed and their income is 10,000 and below, that's the priority of people that I will be advancing those payments. In the meantime, I am sure that what will happen is 3 weeks from now, or even maybe 2 weeks from now, we'll start seeing the federal monies coming in. So then I can continue paying out for the remainder of the filers that have filed for 2018.
Okay, just for accuracy and clarity, then to repeat, those people on island who make $10,000 or less annually are eligible to apply for this tax rebate as soon as next week from the $11 million that you're making.
No, they don't have to apply, Kevin, because we already have the data.
Oh, all right,
So
you're going to send them the
our
checks.
revenue and tax, it's sort of like tax refund, kind of. So everybody that's filed 2018 and 2019, we have that data. So everybody that's filed are eligible. The amount is what is based on what your income is. So like I said, if you are 75,000 and below, right, you get 1,200 if you're an individual. If you're a couple, you get 2,400. If your income as a couple filer is 150,000 and below. So there are some income guidelines, but everybody that's filed your 2018 file or your 2019, but we're using data from 2018 because those files are already completed. Taxpayers have already filed the 2018. So we're using that data to base it in terms of the returns of the money. So it's not like you have to apply because we already have that data in our system. You don't have to apply. If you file for your 2018 filing a tax return, you will be getting a tax rebate. The amount just varies based on your income level. So the 10,000 and below is a priority that I'm doing to advance for right away because those are the individuals that are in the lower income bracket that, if you look at levels of need, we're saying, okay, I only have $11 million. What can I do now to give out to the people? So I looked at our data and we said those that are 10,000, those that file whose income was 10,000 and below are the people that I'm going to start giving the checks out using our local money. So when the federal monies start coming in, those then with incomes above the 10,000 to 75,000 will then be getting the 1,200, 2,400 based on whether you filed individually or as a couple.
Thank you, Kevin.
So I just want to be sure, Kevin, don't use the 10,000 as an eligibility criteria. It isn't. If you filed, you are eligible. Your income is what's going to guide how much money we give out based on the federal law.
Mariana's Business Journal, Maureen Maritito.
Buenas, Governor.
Buenas, Maureen.
So I have some slightly different questions. So I'm clear that you are going to first help the people who are earning 10 million or more or less.
10,000. 10,000, not 10 million.
Yes, I'm sorry, 10,000. So after that, is it anybody and everybody? And will there be electronic payments?
Okay, after that, it would be like the federal program that anybody, again, who filed with their tax returns and we're using 2018 data, uh, can get the benefit, are eligible for that benefit. We
Okay.
cannot do it electronically because we don't have the accounts of these individuals. So we are going to be issuing checks and we will be mailing them.
Okay, and then you said that the money Guam would be getting is 134.8 million.
Correct.
And do you think that will cover all the 2018
Yes,
taxpayers?
because we gave them our information. And so based on our information, then they took that number and estimated and came up with 134.8 million.
Thank you, Maureen. Guam Daily Post, John O'Connor.
Hello, Governor. Can you hear me?
Hi, John. Yes.
Okay. We see the letter that you sent to Speaker Tina Munoz Barnes. We want to know why set the criteria to be $10,000 or less when a lot of full-time workers on Guam make about 20K or so. And as part of this first question, can you also answer when you expect to get that final approval from IRS so we can get the 134 million to the Guam residents?
Right. So the first question is why 10,000? Because when we looked at our analysis of what we can afford based on our general fund revenues and based on our general fund monies, based on making sure that we'll continue providing for COVID-19 response, based on that we can continue providing public services and so forth, we were able to afford $11 million. So when we looked at our data, we looked to see, well, what does this mean? Who can be? And so we looked at the 10,000 and below was the first group of population that who have filed that we were able to then immediately provide the payments to them. And the second question was, what was the second question, John?
It was actually part of the first question, and that was just looking at your letter. When do you anticipate to get the final approval from IRS so we can get
Okay.
134 million?
Right. So as I had explained earlier, one of the criteria in this economic benefit was to provide an implementation plan to the IRS. And we did, like I said, our director was very proactive, really watching this benefit. And as soon as it was passed, even I think before that, she already started her implementation plan. And then she's been on regular contacts with the IRS. So she submitted her implementation plan for this program. Like I said, it's being reviewed by the legal attorneys of IRS and will be also approved by the U.S. Treasury attorneys. Once that's approved, and I don't have any time set for it or any date, but we're hoping by next week or the week after that once it's approved, right after that approval, we expect to start having the funds in within 2.5 weeks.
Thank you, John. Patty Arroyo, K57.
Good afternoon, Governor.
Hi, Patty.
Hi, Governor. This morning, Dave De La Sola said that the Department of Labor on Guam gave a base number of 38,000 unemployed workers on Guam.
Right.
I'm wondering how, and with an unknown figure of how much each of these workers will receive, and it obviously is going to be below the $930 a week that has been prescribed by the federal government. how much confidence do you have in the U.S. Department of Labor being able to consider Guam's unique situation with unemployment insurance and our ability to provide the right amount of compensation for workers, unemployed workers,
Okay,
when we figure it out?
right. So let me just start with this explanation. This pandemic unemployment program has actually two programs. One, which is called the Pandemic Unemployment Program, that's really a program that is geared from to every state that has uninsurance uh, benefits. We don't, but by law, we were included in that pandemic uninsurance employment program. Then there's the federal pandemic uninsurance program, because then the federal Congress was saying, oh, I don't think that's enough for our people. Let's put some more money in. So then the federal pandemic unemployment program came to be. They're giving $600 weekly from that federal pandemic unemployment program. So where the glitch is that in that federal pandemic unemployment program, they identified the District of Columbia, Puerto Rico, and some other territory, but didn't identify us. But some of the provisions in that law, and it's very legally technical, some of the provisions of the CARES Act did reference that we would qualify for that federal pandemic unemployment program. We had gotten guidance that says that if you qualify for the pandemic unemployment program, you also, Guam, will be qualified for the federal pandemic unemployment compensation. So that's the guidance we're getting. We are just verifying that guidance. That's what Dave is doing right now. He's making sure that that guidance is correct, but we have it in writing as a guidance from the Department of Labor.
So the follow-up question is then that, for clarification, that we could still be entitled to the same $930 a week.
I say we are. That's what I'm saying, and we're trying to verify that. But according to the guidance that we've gotten, Patty, our guidance says that the 600 is eligible for us. They may change it, but according to the guidance that we just recently got, that's what it says. The 360, I don't have a number that says 360, but that's what the average unemployment insurance benefit is, and that's what the states are using. So I am confident that we will get that 960. And once we totally verify it, although like I said, Patty, the guidance already has said it, but we just want to make sure. And certainly we will fight very hard to get that 600. Even if I personally have to talk to Secretary Scalia, which actually at a meeting, I asked him, I said, I want our government of Guam, the state, the territories, to be eligible for that, and he's following up and looking it up. It's sort of like the guidance is here, but the people underneath the guidance that needs to do the guidance, they weren't totally informed about the guidance. So we're trying to check that out.
Thank you, Patty. Oil from the point.
Hi, sorry, can you hear me?
Yes,
Okay. How are you doing today, ma'am?
I'm very good, Oya.
Okay. So just kind of a follow-up question to what John was asking earlier. Guam residents have voiced concerns. We're seeing emails and calls to our newsroom about the COVID crisis and the rights, their fundamental rights to privacy in their own homes, choosing where to go and when, and the concern is that those rights are being violated. What is your response to this?
I certainly don't believe that those rights are being violated because, in the overall scheme of things, right? Oya, we
Yes,
are in
ma'am.
a public health emergency. We are in a pandemic emergency. And we are going to do everything we can possibly do to decrease exposure and to decrease social contact, keeping in mind the civil liberties of the individual. But I would think one of those civil liberties also of everybody is to be safe and to be healthy. And what I'm doing is I am focusing on the safety and health of the individual. It is our responsibility, morally and ethically, to make sure our community is safe. And if the governor of a state or an island says, please stay home so we can be safe and we can fight this exposure, I would think that is your responsibility as a civically minded individual concerned about your community. I am not, I am giving them access to the basic essentials of their life. They have access to grocery, they have access to medical facilities, they have access to medicine, they have access to stores to help them with whatever they need to provide in their homes. So I am providing them the basic essential. In times of emergency, things change. In times of emergency, there are waivers, there are rules that are relaxed so we can move quickly and be very efficient in fighting this battle.
Thank you, ma'am. To kind of follow up on that point, senators are currently in session. They're discussing some legislation that includes one that would give you the authority to institute the curfew law and the checkpoints. Assuming that they signed that into or they passed that today, when do you think the curfew law will be implemented? And how are the police going to be able to when can we expect details on those rules and guidelines so that people know how to sort of manage this and police are able to identify who's out there for essential purposes and who's out there gallivanting?
Right. So right now, Oya, I've directed the chief of police. I've directed the TAG, my Major General Esther Agagi. I've directed my legal staff to work together and start planning on how we're going to do this. As soon as the bill's passed, and I will sign it into law right away, I expect it to be implemented either the day after or the second day after, just to give people notification and the ability to understand that that's what's coming down and to educate them on what the procedure and the process is going to be.
Thank you, Oya. KQAM, Adriana.
Hi, Governor. I'm sorry it's a bit, and I wanted to question you in regards to the 50 federal medical stations that were received on Saturday through FEMA. So this contains beds, supplies, and medicines. And in speaking to FEMA, they remain in storage, they told me. And I know that there was a tactics meeting held this week with the Office of Civil Defense to designate areas for the planned alternate care sites. Can you tell us where we're at in opening the sites, where they'll be located, and has there been a set time frame or plan?
Okay, so the 50 FMS beds, and I think we're getting another 50, so we'll have a total of 100 FMS beds. There's a requirement on where those beds are to be used. We cannot use them in tents. So what we're doing now is we're identifying sites that will meet the requirement. And so we've looked at the UOG field house. We've looked at hotels in their like main ballrooms. We've looked at Surgery Center. We've looked at GMH in some of those open areas there also. So we are looking at places that we could be able to house those 100. And so we are going to do it as soon as we have finished our site evaluation. What I do also want you to know is that we are also looking at other alternatives to use camps and to provide our own beds for those camps. I'm tracking the hospitalization because this is all geared on capacity of hospital and acute care. So I'm tracking hospitalizations, and so far we are really tracking in the low end of the spectrum, in the low end of the trajectory. So over the last few weeks, we have really been averaging about between 18 to 20 hospitalized patients a day, which is really good. I'm happy about that. But like I said, we can't be complacent. We must continue on with our vigilance and decreasing the exposure of coronavirus 19.
Right. And so for follow up in regards, I know that you had said that, an early on goal was to have a bed capacity of about 2,000. So,
Yeah.
and now with the alternate care sites, this will require then additional healthcare workers. Is there a plan to build up the healthcare workforce, such as doctors?
There is. We have taken an inventory of all healthcare resources here on island. We are also working very closely with Admiral Manoni. And he is working with us in terms of identifying, I think he's bringing in 100 medical people and another 120. And he did say that would be also available for the community.
Thank you, Adriana. Steve Santiago, PDM.
Can I just add one more time about resources? We're also looking at the Taiwan government to help provide us with some nurses and also even some medical personnel.
Steve Santiago, PM.
Yes, hi, Governor.
Hi, Steve.
Hi. So just going back to the economic impact payments,
Sure.
you mentioned that Guam has been approved for $134.8 million. How many tax filers will be receiving a payment from that money?
I think we're looking maybe 59,000, I think, or more. Wait, Daphne's signaling. Daphne, you can come in and tell them. 59,000 and above. It's whatever the 2018 filers are, and I think it might be 62,000. Daphne can give you the number.
Happy day. So with regards to the economic impact payment and the amounts that were approved, with regards to what the advance payment is going to be from the federal government, that was based on our data from the last 3 years. And so what we did was we looked back at our data. We determined how many people based on the data would actually be able to qualify for the rebate. And then we went ahead and we provided that data to the IRS so that they could provide it to the U.S. Treasury's economist. We also had to factor in, of course, the fact that we're utilizing 2018. Sorry, that's the first kind of large piece is that we're utilizing 2018 as a baseline to determine eligibility for the economic impact payment. And so when we looked at the 2018 data and we looked at data for the years prior, we noticed that not only is the 2018 data less than the years prior, we had to take into consideration those people who had not filed yet, because generally we have a lag. Usually we have a lag of several thousands of returns that come in even beyond the extended due date, which is October 15. We also had to factor in those people who would apply or who would file, who fell below the threshold and who don't normally file because they fall below the threshold. So when we factor all of that in, we gave those information to the IRS. The IRS submitted that to the U.S. Treasury. Now, the amount that we're expecting in terms of number of filers, or sorry, number of economic payments that are to be made, perhaps could be upwards of 60 to 70,000 payments. Again, these were our best estimates based on the data we have. This is something that's a new program. It's something really, again, like the governor mentioned earlier, it's unprecedented. So, you know, the exact actual figure that we're going to end up with is, you know, again, our best estimate is perhaps upwards of 60 to 70,000 checks or payments that are going to be made for the economic impact payments, you know, through the end of this year.
Okay, and as a follow-up, is the implementation plan you submitted to the IRS and the Treasury the same plan you're going to be using to issue that first group of local checks next week? And also, what about people who just joined the workforce last year and didn't file for 2018 return?
So, you know, with regards to the utilization of 2018 as a basis, of course, if you read the CARES Act does say 2019. But with regards to the territories, you know, we have a unique situation. And what we wanted to do, and we have the ability and flexibility to do, in order to be able to follow the law, which the law states that we must get these payments out as rapidly as possible. And that is not just, it was not just Congress's desire, it was also the president's desire. And it's also our government's desire. And because of that, and because we know we have a more full level of filers that's processed for 2018, we decided that we were going to use the 2018 as our basis. So that's why we used 2018. Now, with regards to anybody who, for example, may end up having running into a situation where they may not be eligible because we utilized 2018, there is a mechanism for a true-up. And how that will work is when you file your 2020 return, you'll be able to go ahead and make the, when you file it, there's going to be a mechanism for capturing that. So, for example, for people who may have less income, and the adjustments, it's a one-way adjustment. So if, for example, you got the full amount in, because we utilized 2018, you got 1,200 as a single filer, and say 2020 comes around, you file your 2020 tax return, and you make more, that would have caused you either to be ineligible completely or to reduce your amount. You will not be adjusted, you will not be penalized. But the opposite will, for the opposite situation where perhaps you may have more income in 2018 and less in 2019, you will get that difference when you file your 2020 tax return. Does that answer your question, sir? Oh, and excuse me, so we utilized the 2018 returns, and we're following exactly the implementation plan with, again, with certain exceptions. Will follow, you know, the law, and again, these exceptions are due to the special or the unique situation that we are in the territories.
Thank you, Steve.
Thank you.
Last but not least, Pacific Island Time, Margaret.
Hi, Governor. Good afternoon.
Good afternoon, Margaret.
I want to go back to the federal assistance. You actually mentioned earlier last week that Guam stands to receive 111 million, and you corrected yourself today. You said it's only 11 million. Is that only the rebate component of the CARES Act? And if so, why is Guam receiving less than the CNMI? The CNMI is receiving 37.8 million.
Okay, so Margaret, you're mixing it up with two different things.
Okay.
111 million is the, I think it's called the Coronavirus Recovery Subsidy to the states. So in the CARES Act, there was $150 billion that was appropriated for the coronavirus recovery. These are monies that are directly given to the states and the territories, right? It's a direct subsidy to the states and territories. In the calculations for the states and the territories, the calculations for the territories is, well, let me back up. So there's 150 billion appropriated. 3 billion of the 150 billion is earmarked for territories, and Guam got out of the 3 billion. Guam is going to receive $111.8 million. That's separate than the $11 million that we are going to be handing out to our tax filers in the next week. They're two different programs.
Okay, all right. So this is separate from, this is not under CARES Act. Is that correct?
They're both under CARES Act. Under the CARES Act, there's so many programs and benefits there that I can't even start to, there's benefits for healthcare, there's benefits for education, there's benefits for individual assistance, there's benefits for farmers, there's a lot of benefits. But the main highlight one that is much more of a greater impact to us is the economic impact and the coronavirus recovery. Plus, there's a lot of loans also for small business people, like the pay protection loan, the there's another one, EIDL loan. There's a lot of small business loans that would help for the recovery of the economy in not just Guam, but the rest of the United States.
For closing remarks, Governor?
Oh, are we closing now? I just wanted to say again, I know that we are all very concerned. Certainly, the senators are very concerned. The mayors are very concerned. The business community is very concerned. The healthcare community is very concerned. My mother is very concerned. Your mother is very concerned. Our whole community is very concerned over this coronavirus pandemic. And so, in order for us to allay our anxieties and our stresses, I only ask you to stay home. I only ask you to wash your hands. I ask you to do social distancing. I ask you to decrease your social contact. I ask you not to have gatherings out there. I ask you only to have contacts within your own household. It's very crucial. As you can see from Linda's presentation, a lot of these infection is from social gatherings. A lot of these infections are from community gatherings. So how do we then stop this? We stop this by not gathering out there. We stop this by staying home. We stop this by limiting your activity and the traffic out there in the roads. And so we, again, I ask, and it sounds repetitive, but we need to work together to provide our community the quality of life and the well-being that they so much deserve. So I ask you again to stay home and please, please abide by the mandates and the directives that I have set forth. It is only for the good of our community, and it's because of the love of each other that we are doing this.